Ministry of Health have mandated us to start with 10% of our fleet to be fully electric by the end of 2023. So we've actually been the first health service to start that. Most importantly, it's been through lack of using fossil fuels, like using petrol. Being a health service, you want to make sure you're driving something that's fuel efficient. So I think that's what makes a big difference. Here at Gosford, we've already got the first 2 charging stations, which will charge 2 cars at a time. So there's 4 cars that we can be charging. And then we'll have the similar setup at Wyong will be next, and then followed by along Jetty and Woy Woy. So hopefully we would have by 2030, if not all the fleet, most of the fleet would be electric. And it's nice to be recognised for it, trying to make a difference.
The project is the solar panel project over the bulk of the roofs at Gosford Hospital. The main thing is the sustainability objectives and the environmental improvements that go with that, but it was financially sustainable as well. So it was demonstrated within about a 6.5-year payback that the project was fully sustainable financially. In simple terms, if you considered the total usage for Gosford Hospital, the solar system is capable of generating up to 20% of its usage during the day. But when that's averaged and seasoned out, it's approximately 12% over a year. It directly aligns with everything that's happening right now about going to green energy. So being able to generate and use our own energy on a site which is energy hungry is fantastic for the community and the environment.
Myeloma is a cancer of the plasma cells, and patients with myeloma have a very high disease and treatment burden. They're in hospitals an awful lot. Treatment is essentially mostly chemotherapy or stem cell transplant, and also one of our most immunosuppressed patients. So they're really at risk of hospital-acquired infections. These people who are here most weeks, sometimes twice a week for treatment, were spending an awful lot of the time waiting for something to happen when it was actually just a simple subcutaneous injection. If you take the fact that it's chemotherapy out of it, it was a simple task. Now we have 12 patients enrolled on study and they absolutely love it. It's given them the freedom of administering the treatment at home. I think it's been really very, very good for developing their skills and the confidence in self-management. The satisfaction is very, very high. We're getting excellent feedback. It has created some chair space, so the other side of that is what we were going to develop from a service perspective, which is a little bit more capacity within the day unit. I think one of the best outcomes has undoubtedly been the impact on patients. To be able to talk to somebody in the home who's giving their own chemotherapy there and getting on with their life. We have people who are trying to work. Some people may be in their 40s and 50s and they're trying to hold down a job. So coming to a day unit for treatment twice a week is a huge impact. And I think that's going to really drive our impetus to make this work, to find a way forward, because it's an excellent, excellent programme for them.
The project came about in 2018 when we had an opportunity through the integrative care program to really take a deep dive into wound management on the Central Coast and the services we were currently offering. That revealed that it was a massive issue and that the community nursing service was undertaking a huge volume of wound management. So we looked at reframing what we were doing locally and changed our model of care to create the Specialist Wound Centre, which is a static clinic that operates in the north and south ends of the Central Coast and offers a mentorship program under the direction of a nurse practitioner for our registered nurses.
We wanted our patients that have significant chronic wounds to have expert consultation quickly, so the right management can be put in place, thus they can heal more quickly. It was also put in place to upskill registered nurses, and they are able to then go back into their community nursing sector and provide optimal wound care. The result has been excellent, I think. Certainly the patients are happy with the service. We are seeing progress and wounds that are receiving more optimal wound management. And the collaboration also with other health professionals such as the community nurses, GPs and other medical and allied health specialists has improved. When we have an expertise together, we actually end up with a much better result, and all that leads to better patient outcomes.
We're currently undertaking an economic evaluation with the Hunter Medical Research Institute. We're also looking at our data that we've collected of our patients to see if we are actually achieving our aims of faster healing rates for patients, with the goal of expanding into the future.